Oppositional defiant disorder is classified under disruptive behavioral disorders in the DSM-5. It is better known as ODD. It's a mental disorder found in children characterized by persistent willful aggression and tendency to be hateful towards other people, but not physically. Children and adolescents with ODD display recurrent and repetitive pattern of negative and antagonistic behavior that significantly impact their lives and those around. ODD comes in patterns, which is the emotional pattern, the behavioral pattern, and also cognitive pattern. The emotional pattern includes the child being very easily irritated and very resentful. The behavioral pattern is whereby they are very argumentative, they are very angry, they have outbursts, they dislike rules and also dislike authority. Cognitive pattern is whereby they are very vindictive, very spiteful. The child is very rebellious and very stubborn. They argue with adults because they don't like taking rules from other people. A child can only be diagnosed with ODD by a mental health practitioner that is registered with HPCSA, following properly the diagnostic criteria as in the DSM-5, in which, according to the criteria, to be diagnosed with ODD, a child must have a pattern of angry, irritable mood, argumentative defiant behavior or vindictiveness lasting at least 6 months, whereby they exhibit at least 4 symptoms in the 3 categories or patterns. The symptoms are losing temper, number 1, number 2, being easily annoyed, number 3, often angry, of which this 3 falls under the first pattern, the emotional pattern of angry, irritable mood. Then number 4 is the child is very argumentative. Number 5 is that they defy rules from authority. Number 6 is that the child often deliberately annoys people. The child may pace up and down in class just to annoy the teacher. Number 7 is that they blame other people for their mistakes. This falls under the behavioral pattern of argumentative defiant behavior. And then under third pattern, cognitive pattern, which is characterized by vindictiveness and be spiteful, is symptom number 8, whereby the child has to be vindictive or spiteful at least 2 times in the past 6 months. The symptoms must appear most days than not in the past 6 months. Severity of ODD is in 3 specifiers entirely based on the number of settings where the symptoms are present. 1 setting is mild ODD, 2 settings is moderate ODD, 3 settings or more is severe ODD. These settings may be at home, at school, at play area, etc. Just like many other mental disorders, a direct cause of ODD is not known, but most experts believe that combination of biological, psychological, and social risk factors plays a role in one developing the disorders. Biological factors like a parent with history of ADHD, ODD, or even CD, a parent with mood disorder, drinking problem, chemical imbalance, or even a parent that smoked during pregnancy. Psychological factors like having inconsistent parents that are neglectful. Social factors like poverty, abuse, and neglect can contribute to one developing ODD. ODD can progress to be conduct disorder in some children. The difference between CD and ODD is that in CD, which is conduct disorder, there is physical violence. It is characterized by aggression, distraction, deceitfulness, theft, or even serious violence sometimes. Majority of children diagnosed with ODD can have other mental disorders like ADHD, anxiety disorders, mood disorders, learning disorder, and even language disorders. The most common mental disorder to coexist with ODD is ADHD, as they both share common symptoms of disruptive behavior. Treatment of ODD consists of combination of many things. Firstly, we are going to look at parent management training program and family therapy, whereby they teach the parents and the family members how to deal with the behavior of the child, and teaching techniques on positive reinforcement and a way to discipline the child effectively. Then there is cognitive problem solving skills training, whereby they teach the child positive ways to respond to stressful situations. A child with ODD often only knows negative way to respond to problems. The aim of this training is to reduce reduce inappropriate behaviors. Then there is social skills programs and school-based programs. There is also medication and also individuals therapy. All of this works, they have proven to work. I hope all your questions regarding ODD are answered. If not, please comment down the question below. Remember, a person can live positively with a mental disorder. Thank you for watching the video. Please don't forget to like, to subscribe, and also to share this video. Thank you. Bye-bye.